Hi, this is Tim Flory with AtlasBrainSpine.com, and today we're going to talk about understanding the differences of upper cervical chiropractic techniques. First, let's discuss what upper cervical is. The upper cervical area is the upper neck area, where it meets the base of the skull. Just a small percentage of chiropractors do special training in this area and focus on its analysis and correction. Most of the time, a misalignment in this area causes no pain initially, but rather like a small cavity causes problems to develop over time. If left uncorrected, the entire spine begins to shift from its normal alignment because the alignment of the top bone, the atlas bone, controls the alignment of the entire spine. This disconnect between the brain and the body over the nerves can cause many types of problems, and its correction helps the body to restore itself naturally. Now that you know the immense importance of the atlas, let's talk about the different approaches that you may or may not have heard of. So there are several. First, there's Blair, which is the primary articular approach to upper cervical. There's Grostic and toggle recoil, which are important historical steps in the evolution of upper cervical chiropractic. There's something called QSM, which is more of a tensegrity approach to the body and posture. There is Atlas Prophylax, which isn't even practiced by licensed healthcare professionals. There's Atlas Orthogonal, Advanced Orthogonal, and Orthospinology, all of which spun off of the Grostic work. And then there's Kale and Knee Chest, both of which came from Dr. Kale's original work. In fact, all types of chiropractors will adjust your atlas, but very few have the training necessary to obtain precision correction of the atlas back to its normal position. And to my last point, we have Nuka. We talked about the history of Nuka in one of our previous videos, which you can view in the video description, and discussed what it can do for you. So what is it that makes Nuka the best choice for upper cervical care? I'll be honest, I'm biased. Not only because Nuka was able to free me from a life of disabling migraine headaches, but also because with over 2,000 cases, I've seen remarkable results, long-term results with my own patients. Nuka has earned my respect and dedication for many reasons. You see, the Nuka correction is tailored specifically to you, not just a one-size-fits-all technique. Each person has had their own unique accidents and injuries, and so if your atlas misalignment is unique to you, just like your thumbprint is, then your correction must also be individualized. This hyper-precision is also seen in the correction results due to x-rays both before and after. There are actually many ways that you can get temporary relief, but in order to get long-lasting results, you must get physical structural correction. Essentially, we don't assume or just hope you're getting better, we measure your progress. Due to its precision, it is also, therefore, the most gentle procedure and has zero known risks. No one in the history of Nuka has been hurt due to the subtleness of the correction procedure. With Nuka, we measure our success by how long you hold your atlas corrections, not by needing them all the time. This is possible because it solves the most important problem of making sure the atlas is in place so that all the other vertebrae can follow a more stable pattern due to a progressive retraining process with the muscles, getting used to the normal position of the spine again. And one of the most important features of Nuka is that we perform the procedure by hand, which means that we have real-time feedback that the correction is going as planned. Some of the previously mentioned procedures offer some of these same benefits, but no other chiropractic technique provides this trifecta of being as gentle, hyper-targeted, and effective in addressing the underlying issues for the patient to offer a solution in establishing a better brain-to-body connection. Remember, upper cervical care is a great solution to many underlying health problems, but picking the wrong approach can sometimes make your problems and symptoms worse. Now that you know the differences regarding upper cervical chiropractic, we hope that you will make an educated choice in restoring and maintaining your health for years to come. Again, my name is Tim Flory with Atlas Brain and Spine, and if you want to know more about Nuka and better brain-to-body health, just take a second to subscribe or follow us. Until next time, remember, once you start to restore your brain, you will heal your pain.